health of your horse is the most important factor in his ability to perform. The key to this is to understand and provide proper nutrition, being able to recognize and handle emergencies, and develop a daily routine to ensure good health care. The horse will tell you a lot if you're observant. All horses have personality traits. Any change in attitude should alert you to something being wrong. If your horse usually greets you and he hides in the corner, that's a change in attitude. If your horse is happy, generally, but today puts his ears back or is generally crabby, that's something that needs to be investigated further. A quick look around the stall to see if the manure is solid or runny, if the stall has been disturbed, if the horse has cleaned up his feed or strewn it around. Check the water. Water is an important ingredient in the overall care. Give your horse a routine health check.
You can familiarize yourself with your horse and give him a basic once-over. By knowing the normal parts of your horse, you can identify problems early and nip them before they become real trouble. I like to start at the horse's head. And the first thing that I'll look for is in the nostrils, around the muzzle. Now, if you see any discharge from the nostrils that is yellow or creamy, it could indicate that there's a cold coming on. Normally, we'll see a small, thin stream of clear discharge from the horse's nostril. This comes from the tear duct and is quite normal. Now, a horse should normally hold his eye open, and it should be clear. Any cloudiness in the eye or any discharge coming from the corner of the eye here could indicate dirt or infection in the eye. If the horse is holding his eyelid shut tightly or seems quite painful, there may be an ulcer or a scratch in the eye. This requires immediate attention from your veterinarian. The inside of the ear should be smooth. You should see no insects, no exudate that's accumulated. Signs of ear problems in the horse include head shaking and holding the head at a tilt. Coming back from the poll, along the line of the neck, we come to the withers. Now, it's important to look at the horse's withers because the saddle can rub sores here. So if you see any signs of swelling in the withers, or if you see any signs of hair loss, you should have that examined by your veterinarian. We'll come down the shoulder to the point of the shoulder, and then down the forearm. This area here is the horse's knee. And then in the lower leg, we have several important structures. Now, when you're examining your horse, run your hand over the back of the leg where the tendons and the suspensory ligament are, and see if there's any swelling. If you feel there is some swelling, make sure that you feel the opposite leg for an easy comparison. The front of the leg below the knee has a large bone called the cannon bone. And behind the cannon bone are two smaller bones known as the splints. Splints are a common cause of lameness, especially in young horses. Below the level of the cannon bone is a joint called the fetlock joint. We can feel for swelling of the fetlock joint here. And below the fetlock is the pastern. Below the pastern, of course, is the hoof. Feel down the horse's midline, checking for any swelling. Back here is an area called the sheath of the horse. Now, geldings and stallions will accumulate exudate in that area and may cause infection. Periodic cleaning will help prevent this. And you may want your veterinarian's assistance for the first couple of times that you do that. Your horse may also require tranquilization to have his sheath cleaned. look at the tail head on your horse to make sure that he's not rubbing any hair out. This can be an indication of parasites or allergies or an infection in that area. Come down the horse's hind limb just like you would a forelimb, looking for areas of swelling. Here's the point of the horse's hip. These are the large hip muscles here. This area right here is called the stifle, analogous to our knee joint. This thick muscle group below the stifle is the gaskin. Then we come to the hock joint. Below the hock joint, the structures are essentially the same, with the cannon bone, tendons and suspensory ligaments, fetlock joint, pastern, and hoof.
The horseman's adage, no foot, no horse. Let's take a close look in that area.
It's important to know a little bit about the parts of the horse's foot so that you can talk to your veterinarian or your horseshoer if you happen to have a problem in that area. So now let's go down to the ground and take a look at the hoof of the horse. The back of the foot here, we see the heels. And these fleshy areas just above the hoof itself are called the bulbs of the heels. A very important area on the hoof is right at the hairline here. This area is called the coronary band, and it's responsible for all of the hoof growth. And the area that grows down from the coronary band is called the wall of the hoof. Before I can show you the bottom of the horse's foot and how to work on it, I need to show you how to pick it up. Now this is an experience that can often be a little scary for both the new horseman and the horse owner, but by following a few simple steps, you can make this a very safe and a very easy experience. The thing that I think is very important is to start high on the horse so that he knows where you are and what you want to do. I start with the front leg by stroking down the horse's neck, down his shoulder, down the leg, until I get to the tendon area. Now often when you get back here, just a gentle squeeze and a little cluck is all that the horse needs to pick the foot up. Now on the bottom of the foot, we can see several important areas. To orient you to the bottom of the horse's foot, here we are at the heel area again. Now this triangular structure here, that's very fleshy, is called the frog of the horse's foot. We think that as the horse walks, pressure on the frog causes blood to be pumped up from the foot, so it's a very important area. This flat area right here is called the sole of the horse's foot, and the groove that's between the frog and the sole is called the sulcus of the frog. And if a horse has a heel, he must have a toe, and that's right at the front of the hoof right here. You set the horse's foot down on the ground. Don't just drop it, because the horse may be startled by that. Go ahead and set it down gently. Now to pick up the hind foot of a horse, I like to start all the way up here at the withers. Again, we want to make sure that the horse knows where you are at all times, so stroke down his back until you get to the area of the hip. Now before you proceed any farther down the leg, I think it's important to recognize that your stance here can protect you from getting kicked. If you stand so that your legs are away from the swing of the horse's leg, you're not going to get kicked if he happens to jump like this and not like this. So as we go down in the horse's leg, let him know that you're there, click to him, bring the leg forward. Then you can step under the leg and support him so that you can clean out his hoof. To clean out the horse's foot, you're going to need to have a hoof pick. To clean it, you want to take your pick and begin at the edge of the shoe, cleaning all the way around, cleaning the rim of the shoe and the sole. Then go down next to the frog, clean out the sulcus of the frog. Always pick away from you so that if the pick slips, there's no chance of it sticking you in the arm or wrist. A small amount of bleach or a commercial foot preparation may help prevent thrush, a condition I'll talk about in a minute. When you're done, go ahead and step away, support his leg, and let him down slowly.
Hoof care is an important basic. Two major areas of concern are cracking and thrush.
Hooves that are too dry can crack. Hoof dressings help seal moisture into the foot, and they're applied over the whole hoof wall as frequently as needed. When cracks enter the coronary band, they're painful, just like a split cuticle on your fingernail. These can take months to grow out, so a little care here can prevent a chronic lameness problem. If you don't pay attention to keeping the bottom of your horse's foot clean, he may get thrush. Thrush is a term for a bacterial infection of the foot, especially the frog, and it's easily recognized by its signs of a soft, moist area of the foot, a foul odor, and lameness. It occurs in conditions of moisture like deep wet stalls or when manure stays packed in the foot. To treat or prevent thrush, clean the foot out thoroughly and apply bleach or a thrush preparation. Allow it to soak into the foot and especially the sulcus of the frog for a moment before setting the foot back down. Regular treatment of the foot can prevent a rather nasty problem. There are many reasons for wrapping your horse's leg, and we'll show you how to end up with a nice bandage like this one that can be used for shipping, protection in the stall, or therapy. First, apply a leg quilt or cotton to the leg below the knee. Traditionally, this is applied so that the tendons are pulled to the inside, but in my experience it doesn't make a lot of difference. Don't try to pull the quilt tight. The leg wrap will be used to apply any pressure if needed. Next, apply the leg wrap. Start at the middle of the leg and go down to the level of the fetlock, then work your way back up to the knee, overlapping layers as you go. A flannel wrap, as shown here, is nice because it's difficult to pull too tightly, but a variety of products, including felt, polyester, and elastic disposable bandages can be used. In an emergency situation where there is swelling or hemorrhage, some pressure may be desirable, but it's always important to apply padding underneath the wrap. A leg wrap applied too tightly with no underlying pad can cause sloughing of the skin or more severe injury such as damage to the tendon, a so-called bandage bow. Don't apply pressure wraps without first consulting your veterinarian. When the bandage is completed, tape the top down securely. If you find this inconvenient, leg wraps are available with string or Velcro fasteners at the end of the wrap. And if your horse likes to amuse himself by chewing off bandages, apply a little cayenne pepper or pine tar to the outside to help dissuade him.
Good grooming starts on the inside, as well as affecting everything the horse does on a daily basis. A thorough understanding of nutrition makes it easier.
Horse in the wild is pretty lucky. They don't need very much. They have free access to good fresh grass and lots of clean running water and all the minerals that the soil provides. But unfortunately, the conditions that we impose upon the horse in captivity don't allow for that. Using a combination of dried natural feeds and combination products, we try to do the best we can for the horse. Of course, everybody has different opinions for what's good for a horse, and this has led to a lot of myths. Well, I can't tackle all of the myths, but hopefully I can give you a few pointers into good basic nutritional care for your horse. To tell if you're doing a good job in feeding your horse, you need to have a good idea what a healthy horse looks like. Now, of course, horses are individuals and they're going to vary for size and weight, but there are a few basic things that you can look for. Now, one of the important things that you want to look for is the condition of his body weight. You don't want to be able to see your horse's ribs, but you would like to be able to easily feel them when you run your hands over his side. If a horse is overweight, he's going to tend to get hot when it gets hot or when he has to exercise, and it may decrease his performance. The other thing you want to look for is to have the coat nice and shiny. That's another indication of health. Now, as we emphasized, it's important that you have your horse on a good parasite control program, and it's also important to pay attention to the condition of their teeth. But the number one cause of poor doing and weight loss in the horse, in spite of everything, is inadequate or inappropriate nutrition. So take a good look at your horse, get a good feel for how he looks and how he's supposed to look. In order to understand what you're doing by feeding your horse, you need to have a good idea of what the feeds provide. Now, basically, they all provide different levels of the same thing. And the most important thing that feeds provide is energy.
Racing to the half-mile pole, With Liberty has the lead by a length. Hot Drums along the rail is now second by a head.
Energy is no more than calories, and calories provide the basic fuel for the body to go on. Calories are important for the horse to walk, to breathe, those simple concepts. And calories are provided as carbohydrates and also provided as fats. Fats are a very concentrated source of calories, and the horse can use fats very efficiently. When you're thinking of calories, that's what the horse needs if you want to put weight on your horse or if the horse is being forced to go into some heavy performance. Think energy. That's the number one thing that feeds provide. Feeds also provide protein at different levels depending on the feed. Now, protein is an important structural component. It's used as the basic building blocks for all tissues of the body. And you need to feed a level of protein that's appropriate for the horse. When you feed too much protein, the body does not use it to build things. The body uses protein for energy. And protein, although it is a source of energy, it is an expensive and an inefficient source of energy, and it requires a lot of metabolic work for the body to use protein. Vitamins and minerals are important, but possibly overemphasized parts of your horse's diet. Vitamins play the role of so-called chemical cofactors. They're important in a variety of chemical reactions that occur in the horse's body, but the horse can obtain most of these from the feed, and he can synthesize all the B vitamins and all of the vitamin C that he needs. Minerals also play a role as cofactors in the body, but in addition, they're also major structural components, particularly calcium and phosphorus. Calcium and phosphorus are very important in the horse's diet, and the balance between calcium and phosphorus is quite critical. We'll talk more about that later. There are also a number of so-called trace minerals, and trace minerals are just found in small traces in the horse's diet, and it's impossible for us to create a diet that's deficient in most of the trace minerals, so we really don't know what they do. Vitamins and minerals may be important in a horse that's under stress, like a late-term pregnant mare or a horse that's on the show circuit, but if you have a good balanced diet, extra vitamins and minerals may not be needed. A horse's diet is naturally high in fiber. Fiber is very important for the horse. It provides a source of energy, but most importantly, it provides a substrate for the normal intestinal bacteria. Finally, although it's not a nutrient itself, water is a very, very important part of your horse's diet. Now, all too frequently, people think that all they need to do is just provide a bucket of water for their horse, go out and check it every 3 or 4 days, and that's enough. But a horse needs a good, constant supply of fresh, clean water. If you have an automatic waterer, make sure that you clean it regularly. If you have a bucket, change it a couple of times a day. Good, clean water is essential for your horse's health. Okay. You need to have a familiarity with the basic feedstuffs that are available for your horse. The cornerstone of the equine diet is hay. Now, hays provide most of the essential nutrients. They provide dietary fiber, and they provide a great deal of energy. They're also good sources of protein. It's important to keep the level of hay high in your horse's diet, because when hay is the primary form of energy, it's safer. If grains are the primary form of energy, you increase the risk of grain overload, and you increase the risk of colic and founder. When you're buying hay, make sure that you get good quality hay. Now, good quality hay should be green,
should be fresh smelling. It should have plentiful leaves and fewer stems. And it should not have a lot of dust in it. With alfalfa hay like this, do not look for a lot of blossoms. Hay blossoms after it loses its maximum feed value. So blossoms are not something that's good in hay. What you don't want in hay is hay that looks like this. This hay is dusty. It has discolored areas. And it smells bad. This is moldy hay. So always make sure you're feeding good quality hay. Basically, there are two types of hay that are available. We have the alfalfa or leguminous hays and the grass hays. Now, this is alfalfa hay, and you can see the large amount of leaves that are in alfalfa. And this is a grass type of a hay. This happens to be oat hay, but there are a variety of native grass hays depending on the part of the country that you're in. Most of the country feeds grass-type hays because those are the most readily available. However, in some parts of the country, you can only get alfalfa hay, and so that's what's fed. Now, when compared to grass hay, alfalfa hay is higher in protein, it's higher in energy content, it's about equal in fiber, and it has a very high level of calcium. In fact, the level of calcium in alfalfa hay can be so high when compared to phosphorus that it actually creates an imbalance in the diet. So it's something you need to be careful of. Now, there is a myth about alfalfa hay that alfalfa is hard on the horse's kidneys. Because of the level of protein in alfalfa hay, there's a great deal of nitrogen that's produced. And nitrogen is excreted by the kidneys. So if your horse is on alfalfa hay, he will tend to urinate more. However, if he has free access to water, this shouldn't be a problem. There are basically three different forms that you can feed hay. Now, in my opinion, long stem hay is the best way to feed. It's the most natural way to feed, and it provides the horse with a great deal of chewing satisfaction. They can't just rip through the feed and eat as fast as they can. That, in turn, helps decrease the incidence of stall-related vices like cribbing and stall weaving. But the problem with loose, long stem hay is that it's difficult to store because it requires a lot of room. It's wasteful because horses will tend to pick through it, and it may tend to be dusty or moldy. So a number of people have gone to putting alfalfa into processed cubes. Cubes are easy to store because of their smaller size. They're less waste when you feed them, and they're easier to measure a precise amount for your horse. However, your horse may find that they're somewhat less palatable, and they can eat them faster. Now, this decreases the chewing satisfaction and may increase the number of stall-related vices, and also by eating faster, it may predispose them to choke. You can also get hay in a pelleted form. Now, most of the same things that apply to cubes also apply to pellets. Pellets may also be a little less dusty than cubes. A complete balanced ration can be formulated in a pelleted form using a combination of hays and grains.
And there they go. Go West young man is going to the front. Balzac is second. John Henry third and now taking the lead. Arco is fourth. Look Fast fifth. Captain Dare and Climactic and Red Crescent. Around the far turn, it's John Henry in front by 2 lengths.
When your horse is being heavily exercised, such as in the reining, and even more in racing, the how, why, and when to feed grain becomes very important.
John Henry, Balzac, and Go West young man John Henry and Balzac nose to nose, and John Henry is the winner by a hit.
Grains are an important source of energy and should be supplemented in times of additional energy need, such as during pregnancy and during heavy exercise. Grains contain moderate amounts of protein. They are relatively low in calcium compared to phosphorus, and they're also quite low in fiber. Corn is the most highly concentrated source of energy for your horse. It's about 90% usable energy. For this reason, corn has the reputation of being a hot feed. But really, it's not hot, it's just high in energy. But when you feed corn, you should feed it on approximately 2/3 the level that you do other grains. Oats are the grain most commonly fed to horses. Oats are approximately 70% usable energy, and oats come in a variety of formulations. In some parts of the country, there's a significant amount of barley fed. Barley is similar to oats, but it's generally slightly higher in protein. Combinations of grains and protein supplements occur in what's generally referred to as sweet feed. Now, sweet feed has molasses in it, but if you feed your horse a sweet feed, you shouldn't feed more than 5 to 10% molasses as a percentage of the ration. Grains are generally processed for consumption, usually either being cracked or flaked or crimped. This generally improves the palatability, although it may not help the digestibility. So-called racehorse oats are no more than oats with the hulls removed, but you should get processed grain so that your horse will eat it better. Here are some general feeding rules for your horse. Number 1, start with a healthy horse. Number 2, avoid using spoiled, moldy, or rotten feeds. Number 3, basic levels of consumption are, if your horse is under 600 pounds, feed about 2.5% of his body weight per day. Between 600 and 1,000 pounds, feed 2.25% of his body weight per day. And if he's over 1,000 pounds, feed 2% of his body weight per day. Number 4, the minimum roughage in the diet should be about 1 pound per 100 pounds of your horse. Most normal diets are 1 to 2 pounds per 100. Number 5, if you need additional energy, feed grain. The amount of energy that you can get from hay will be limited by the bulk of the feed. Times when you'd need extra energy would be weight gain, the last 3 months of pregnancy, and for performance. If your horse does light work, start at about 5 pounds of grain for a 1,000-pound horse. If he does medium work, 7 to 10 pounds of grain for a 1,000-pound horse should do. And if he does heavy work, like endurance or cutting, as much as 12 to 13 pounds of grain for a 1,000-pound horse may be needed. Number 6, feed on a regular schedule. Don't leave the grain in the feeders to ferment, and make sure that they clean up all the feed you give them. Number 7, feed according to the condition of your horse. Remember, these are guidelines and not hard and fast rules. Number 8, make your ration changes gradually, over a week or so. This will help prevent colic and help prevent your horse from going off feed. Number 9, the optimum ratio between calcium and phosphorus is 3 parts calcium to 1 part phosphorus for weanlings, and up to 5 to 1 for mature horses. As far as protein levels, feed 10 to 13% protein for 2-year-olds, stallions, lactating mares, and performance horses, and somewhat less, 9 to 10%, for maintenance of mature idle horses. Number 11, feed by weight of the feed, not by volume. And finally, treats like apples and carrots are good for your horse, and help keep him interested. A variety of supplements are available for your horse, and you can supplement your horse for everything from hooves to hair to bone to just about anything you want. But basically, supplements aren't needed if you have a complete and balanced diet. Let's talk about a few of the supplements. Now, the most common thing that's supplemented is protein. As we talked before, protein in excess is just used for energy. So unless there's a protein deficit, you shouldn't be supplementing for protein. In addition, excess protein has been implicated in some growth problems with foals, such as epiphysitis and flexure deformities. Be careful with protein. We also have what are called coat conditioners. Now, a horse can get all the fatty acids that it needs from its feed except for one. And you can supply the one with a little bit of flaxseed or a little bit of corn oil, like a quarter a cup, and you'll be able to keep your horse's coat nice and shiny. Vitamins and minerals are very commonly supplemented, and again, a balanced diet may provide all the ones that you need. But under conditions of stress, it may be helpful to keep your horse's diet balanced with a vitamin and mineral supplement. Avoid, though, the single supplement type items. Things that contain vitamins A, vitamin D, things that contain selenium or contain iodine may be toxic. If your veterinarian advises that you use a single supplement product, go ahead, but otherwise avoid them.
Some helpful hints about working around your horse safely, and some basic health care routines, including shots, worming, and teeth.
In the course of your day-to-day workings with your horse, you're going to be doing some things to him that he may not like. So it'd be helpful to know a few basic restraint techniques so you can do those things. One of the simplest involves picking up your horse's leg. When working on a forelimb, picking up the opposite forelimb may be helpful in getting the horse to stand so you can work on a leg. Similarly, when working on a hind limb, pick up the forelimb on the same side. This will cause the horse to bear weight on that hind limb, and you can do whatever you need to there. Now, if you need to do something more, taking a little pain to the horse to divert their attention from the area you're working can often be helpful. For weanlings and babies, one of the simplest things you can do is what we call a skin twitch. Now, with a skin twitch, you want to grab the skin on the horse's neck and roll it up tight. An adult horse usually isn't bothered by this too much, but like I said, it's real useful for young horses. One of the most common things that we do to an adult horse is called twitching them. A twitch is nothing more than a device that slips onto the nose of the horse, and this is a simple little metal twitch that you can pick up at any tack store. To apply a twitch, stick your hand through the metal part here, and then go up to the horse and stroke him on the nose. Grab hold of his nose. Misha's obviously had a few twitches put on him. Bring the twitch around and squeeze it tight. Now, this isn't really as cruel as it seems because it appears that this may actually be an acupressure point. Finally, if your horse is really, really bad, you may want to go and grab his ear. And all you do is come up alongside of his head, take hold of his ear, and pull. The problem with this is that it can make your horse head shy. Most horses don't object to simple restraint. If you have a horse that really seems to object, or is head shy, or gives you some problems, it might be useful to view Dr. Miller's tape on influencing the horse's mind. Now let's go over to the truck and look at a few things that we do for basic preventative health care for your horse. An important part of a preventative health care program for your horse involves vaccination. Now, there are a variety of vaccines that are available, and which ones that you use are going to depend on the area of the country that you live in. However, I think that everyone would recommend that you vaccinate for tetanus, which is caused from wound infection,
and also for influenza and rhinopneumonitis, which are viral respiratory diseases. Pregnant mares should be vaccinated for the abortion form of rhinopneumonitis on the 5th, 7th, and 9th months of gestation. If your horse is a performance horse like Misha here, or as a show horse, he should probably be vaccinated quite frequently, as opposed to a horse that lives in the backyard and he may only need it once a year. Now, vaccinations are administered via injection in the muscle, so it's a good idea to have your veterinarian out to vaccinate your horse and tell you which vaccines to use and how often to use them. Internal parasites rob a horse of valuable nutrients and can be associated with unthriftiness, weight loss, in young animals, pneumonias, and most severely, colic, which is abdominal distress in the horse. Basically, there are 3 methods of controlling worms in the horse. One is feed dewormers, and in my experience, horses generally don't eat these very well, so I don't recommend them. The 2 types that I do recommend are paste dewormers and deworming via a stomach tube. Now, to administer a paste dewormer, it's really not very difficult. There are a variety of paste formulations that are available, and you should rotate them with advice from your veterinarian. To give them, though, reach up by your horse's head and grab hold of his halter. Now, I like to take my little finger and stick it in the corner of his mouth. That gets the horse used to there being something in his mouth. Then I bring the paste up alongside my arm so that he can't see it and give the whole dose in his mouth. The other method of administration is via a stomach tube. And this is a stomach tube. And the tube is passed through the horse's nostril. It goes then down his throat and all the way down into his stomach. The advantage of administering medication via a stomach tube is that the medication goes directly into the horse's intestinal tract. Often with pastes, horses will spit it out if they have a mouthful of feed and you're just not sure how much of the medication that they get. The disadvantage of tubing a horse is that the horse is going to have to be restrained for this and may object. I recommend that your veterinarian always tube your horse. As for frequency of deworming, I think that worming a minimum of every 3 months is recommended because the parasite's life cycle needs to be interrupted before they reach the adult egg-laying stage. So on every 3-month basis, rotating wormers with advice for your veterinarian, and your horse should be in good shape as far as parasites are concerned. Another part of your routine health care program is teeth floating. Floating just means filing down the points of your horse's teeth. Horses develop points on their teeth because their teeth don't match up naturally like ours do. They actually overlap to the side a little bit. And as they grind, parts of the surfaces don't wear out and they develop points. Now these points can stick the horse in the side of his mouth or in his tongue and be responsible for the lacerations, but also more severely for weight loss and sometimes difficulties with the bit. Now to correct these, we use what is called a tooth float. And a tooth float is nothing more than a file. To use the tooth float, we insert it into the horse's mouth, and at the proper angle, go back and forth, taking off those points. Now Misha's really good about this, and it can often be quite a bit more difficult. Your horse should have his teeth checked yearly and see if they need to be floated.
An often neglected area is a well-maintained horse health kit.
Your first aid kit should include some leg wraps. These are cotton leg wraps which are commercially available, but a disposable baby diaper will work just fine. It's also important to have some loose cotton This can be used in cleaning up wounds or packing foot abscesses. I like to have an instant cold compress. If your horse has an area of acute swelling or if he has some hemorrhage, these can be really useful. If you have some bleeding, the cold applied to the blood vessel will cause it to constrict and slow down the bleeding. An aerosol antibiotic is very good if your horse has scraped away the hair without actually having a deep cut on the skin. If he has cut himself deeper, some iodine-based soap and solution is very useful for cleaning those cuts in preparation for the veterinarian's arrival. Thing to have is an extra hoof pick. These have a way of disappearing, so put one of those in your first aid kit. And it's also convenient to keep your thermometer in the first aid kit. An antiseptic wound dressing is very helpful for keeping a wound clean and applying underneath the bandage. Against the wound, you should always use a non-adherent pad, so keep several of those, and some adhesive tape may help keep the pad in place until the veterinarian arrives. Finally, have some commercially available leg wraps. You can buy these, which are disposable, or you can just use any sort of a leg or polo wrap to help keep the bandage in place and to keep some pressure on. Now, a toolkit works very nicely to keep everything in. You've got a nice package ready to help your horse in case he needs first aid.
There are things you can routinely do to check your horse's health, such as temperature, respiration, and pulse.
A quick once-over of your horse shouldn't take more than a minute or two, and it can help alert you to some problems. Additionally, you can take checks of your horse's vital signs, his pulse, his temperature, and his respiration to get a more accurate assessment of the true status of his health. Now, one thing that's very easy to do is to take your horse's temperature. You need a rectal thermometer that you can get at the tack store or a human drug store. You shake that down below 99 degrees and insert it into the horse. A small alligator clip is useful to attach to the hairs of the tail so you don't lose the thermometer. Now, while the thermometer is reading,
let's take the pulse. A normal horse's pulse is between 32 and 44 beats per minute. This will be higher in a sick horse and higher in a young horse.
Take the pulse, follow the line of the muscles of the horse's jaw to where it intersects with the line of the jaw itself. There you'll find a small artery pulsing. And don't press too hard or else you'll just shut it off. Now, it's easy to check how fast your horse is breathing by watching the flare of his nostrils. Normally, when he breathes, his nostrils will expand and contract slowly as he breathes. Check the number of breaths per minute. And normally, a horse at rest will breathe between 12 and 20 breaths per minute. Again, this will be higher in young horses, and will also be higher in sick horses. The stethoscope can also be helpful, and you can pick one up for not a lot of money at a medical supply store. With your stethoscope, you can listen to your horse's heart, to his lungs, and to the sounds in his gut. Put on your stethoscope, and to listen to his heart, you want to be right behind his left elbow. Of course, this rate should be the same as what you felt on his pulse. The lungs, you can hear in an area about like that. Place your stethoscope in the middle of that area. And if you hear anything at all, the sound should be very clear and very soft. Finally, to listen to his intestines, put your stethoscope down here on the flank. plenty of loud gurgling sounds, like what you might hear when you're real hungry, mean that your horse is normal. Condor's temperature is 100 degrees on the nose, and a normal horse's temperature is between 99.5 and 101 degrees.
Emergencies. Recognizing them, preventing them, and what to do about them.
Emergencies will require immediate care by your veterinarian at any time of the day or night. Now, the first of these conditions would be fever. As we told you, a normal horse's temperature is between 99.5 and 101 degrees.
An acute rise in temperature to 104 degrees or above can be considered an emergency. If the sign of a high fever is ignored, the underlying disease problem may worsen and become difficult or impossible to cure.
Now, fever can be associated with a variety of conditions. Any number of infections can cause fever. Also, heat exhaustion is another condition that can be associated with fever. And you'll see signs that point to a particular system that could be causing the fever. For instance, if your horse has a cough and a discharge from his nose, that may be resulting in a fever. Cough and nasal discharge, when associated with a fever, could indicate a respiratory infection. Extreme depression, recent exercise, a lack of water, and rapid breathing may indicate heat exhaustion. Now, treating a fever is going to depend on the cause. If the cause is infectious, treatment with antibiotics may be indicated. With heat exhaustion, where fever is a primary problem, you may want to use agents to lower the fever itself. But the important thing is to recognize that the fever itself is the emergency and to call your veterinarian. Founder is another emergency. Founder is the horseman's term for what we call laminitis. And laminitis means inflammation of the foot. Now, the signs of laminitis in the horse are many. The number one thing that you'll recognize is that your horse is walking very tenderly. His feet will be spread far out in front of him. He'll be what we call walking on eggs, very tenderly, because his feet are sore. Additionally, in the hoof itself, you'll feel a great deal of heat. And you'll also feel a great deal of increased pulse if you feel back behind the pastern. There are a variety of causes for founder, and some of them are important to recognize because you can stop the founder before it occurs. But among the causes of founder are grain overload, where your horse may break out of his pen and get into the grain room and engorge himself on 25 pounds of corn. We see founder with retained placenta in the mare after foaling. We see it from horses that have not been exercised and have been taken out and ridden extremely hard, so-called road founder. We'll also see founder in ponies that have been out in grass pasture. After exercising your horse, if you allow him unrestricted access to cold water, he may also founder, so cool him down first. Now, founder is such a serious problem because of the way the hoof of the horse is constructed. The bone inside the hoof is laminated to the inside of the hoof. And with laminitis, inflammation can actually cause the bone to rotate inside the hoof, and it can drop out the bottom of the hoof, resulting in destruction of your horse. The best way to treat founder is to prevent it. So if you can prevent or recognize the conditions that cause founder before the founder occurs, you'll be way ahead. For instance, if you know that your horse got into the grain room, call your veterinarian. He can come treat the horse and hopefully prevent him from foundering. Similarly, with a retained placenta, removal of the placenta from the mare at an early time can prevent the problems associated with founder. The horse with exercise, if he continues to exercise, can drink as much as he wants. But again, when he stops exercising, cool him out first before you let him drink. If your horse isn't in good shape, don't take him out and exercise him hard. He might road founder. Now, if your horse is already showing the signs of founder, that is walking on eggs, the heat in the foot, and the increased pulse, call your veterinarian immediately.
He may well want you to do a few things before he gets there, but call him for advice anytime, day or night. Colic is the horseman's term for abdominal pain or distress in the horse. The signs of colic include sweating, pain, rolling, looking back, nipping at the flanks, and general discomfort. There are a variety of causes for colic, and they can range from an intestinal twist, diarrhea, constipation, impactions of sand, or just simple gas accumulations. Anything that causes distension of the bowel will cause pain and colic. Now, before you call your veterinarian, take time to note a few of the signs. Check your horse's pulse and listen to his abdomen to see if you hear those gut sounds. That's important information for your veterinarian to know. Now, the majority of colics are routine, but you can't always tell from the signs whether they are or not, so you should call your veterinarian. The treatment is going to vary. If it's a simple gas colic or an impaction, perhaps oiling the horse and giving him a mild painkiller is all that your horse will need. But if your horse has a twisted intestine, this can only be corrected surgically, and that will require some true emergency care. Unfortunately, you can't prevent all colics, but you can do a few things to help ensure that your horse will stay relatively free of colic. As we said before, one of the important things is parasite control. Routine deworming will help prevent what is considered to be a common cause of colic. Avoid sudden feed changes. If you're going from one batch of hay to another batch of hay, mix the hays for a few days to avoid any change in nutrient content that may cause a colic. In areas where sand accumulations in the bowel are a problem, frequent doses of bran may be helpful in moving the sand on. But if you have a colic, call your veterinarian. Even if it's not serious, his treatment can help prevent serious complications. I get a lot of questions about foaling. Fortunately, the horse doesn't have a lot of foaling problems, but a couple of them are true emergencies. Let me tell you a little bit about what normally happens with a foaling, and then we'll talk about some of the abnormal things. The normal period of gestation in the mare is approximately 11 months. And if you know your breeding date, you can be fairly accurate about calculating a foaling date. The mare's plane of nutrition should be increased approximately 3 months before you expect her to foal. And as foaling becomes imminent, she's going to show you several signs. The earliest sign is swelling and filling of the udder. It's going to fill with milk for the baby to drink. As foaling becomes closer, say within 2 to 3 days, you're going to begin to see the musculature of the flanks and the vulvar area start to relax in preparation for foaling. A mare's udder will develop what we call wax on the ends of the teats. This is secretion from the mammary glands, and it starts to accumulate about 48 hours before foaling. Now, most people never see their mare foal. Even if they get up every 2 hours through the night to check her, a foaling normally is a rapid process. It usually takes only 30 minutes between the time that the mare lies down and the foal is on the ground. But here's where some of the emergencies can occur. Initially, when the mare foals, she will have a bag of what we call water that breaks. If the foal's not delivered within 2 hours after the water bag breaks, call your veterinarian immediately. Reasons that your foal may not be delivered within 2 hours would include a primary uterine problem where the mare is not contracting normally, and a primary foal problem where the foal is either not in normal presentation or the foal is abnormal with a large head or a leg cocked back under it. Normally, when your foal is delivered, the front feet will come out first, followed by the nose. Any variation from that should be seen by your veterinarian. Now, after the foal is on the ground, the placenta should be delivered within 2 hours. As I said before, a retained placenta is a cause of founder in the horse. After the foal is on the ground, there are a few things that you can do to make sure that he starts off his life in a healthy manner. The foal should be up and nursing within 30 to 60 minutes after delivery. you should disinfect his navel with an iodine solution to prevent infection that will travel up the umbilicus. Also, you should note to make sure that your foal has a normal defecation within a few hours after he's born. Any signs of straining can cause impaction and colic in a newborn foal. It's important that in the first 6 hours of life that your foal nurse a lot. In the mare's milk are immunity factors that are important in preventing disease in the newborn for the first 2 months until they're vaccinated. So make sure that the foal has a lot to drink, especially in the first 6 hours of his life. Now, if you have any questions about whether your foal is normal or what to do for him, call your veterinarian and he'll be glad to help you. Horses cut themselves a lot, but there are a few things that the horseman can do to ensure that the end result of a colt will be cosmetic and functional. There are basically 3 principles that you should follow when your horse cuts himself. Number 1 is to control the bleeding. Now, the number 1 way to control bleeding is with direct pressure. Any sort of a bandage or just holding a towel firmly up against the leg, if the horse cuts his leg and will let you do it, will control the bleeding. Number 2 is to keep the wound clean. Now, you can scrub it out with a disinfectant solution, or even a hose will work just fine. Finally, there's what we call the golden period of wound repair. If you have your veterinarian out within 6 hours after a cut has occurred, you can expect that the end result is going to be good. So keep the cut clean, stop the bleeding, and have your veterinarian out to repair the cut within 6 hours. Tying up is a horseman's term for a muscle problem that horses get into. We see tying up at 2 times. The first time is with a very fit or a very unfit horse that's been taken out and immediately exercised hard. The signs of tying up that you'll see are an immediate stiffness, particularly in the hindquarters, and soreness in the back. The cause for tying up is somewhat questionable, but there's no question that if you don't get your horse treated, you can result in some severe problems, especially of the muscles and kidneys. The other time that you'll see your horse tie up is at the end of a ride. If your horse is exhausted, his muscles begin to cramp, and again, those same signs of stiffness and pain can occur. When your horse ties up, don't move him. Let him stand there, maybe get him a little bit of water, perhaps a little bit of feed, and call your veterinarian. Until your veterinarian arrives, don't move your horse, because that can increase the amount of muscle damage that's already occurred. Just take a cooler or a blanket and keep it over him to keep the muscles warm and relaxed. Another emergency situation is what we call choke. A horse that engorges himself on hay, pellets, or hay cubes can get some of this material stuck in his throat. The signs of choke are distress. The horse will panic and act like he's pawing at the ground. Sometimes they're quite similar to a colic. Additionally, you may see feed or water coming out through the horse's nostril. Call your veterinarian. Well, somebody else needs to see me now. I hope that these tips have been helpful to you, and I wish you the best and a happy and successful career with your horse.